Assessing craniovertebral stability is neither complicated nor dangerous. In fact, it is safe and simple. The traditionally taught tests, although I'm discovering that very few undergraduate programs teach them nowadays, and this is irresponsible, although it is responsible because these tests are unnecessarily complicated and aggressive, potentially compromising already vulnerable structures. Reliance on production of cardinal signs and symptoms beggars belief and is unnecessary. Impact on vital structures can be avoided. There is an alternative, sophisticated, subtle assessment procedure which enables examination of the integrity of the odontoid, the transverse and alar ligaments with unrivaled clarity, safety and confidence. Now, this is how I felt as a much younger physiotherapist when asked to assess the stability of the craniovertebral complex, and I get a sense that nothing much has changed. It needn't be this way. Here's an example of os odontoideum. Now, os odontoideum is where the odontoid has not fused with the body of C2, and this allows anterior translation of C1, which compromises the space available for the cord. Now, os odontoideum is more common in Down syndrome, and this is why stability testing is mandatory in those with Down syndrome. Here's a lateral view inflection, and this is taken primarily to assess the atlanto-dens interval. Here's the atlanto-dens interval here. So there's the anterior arch of C1, and there's the dens. Now, the transverse ligament keeps the atlanto-dens interval to less than 3 millimeters in adults and less than 5 millimeters in children. But you can see here in this case, during flexion, C1 has translated forward, once again compromising the space available for the cord and widening the atlanto-dens interval significantly. Now, the diameter of the canal at this level is 3 centimeters. The cord takes up a centimetre, the dens takes up a centimetre. You've got a whole centimetre to feel for laxity. I just cannot understand why there is a need or why tests are done that reproduce the cardinal signs of cord compression. Here is an antero-posterior view, an AP view, or through the mouth view. And you can see this is taken primarily to assess, well, not only the dens or the odontoid, but also the alar ligaments. Here's the odontoid, and you can see either side of the odontoid. These are called the periodontal spaces. And you can see the space on the right, so your left, is increased compared to the one on the left. And also the spinous process of C2 is to the right of midline. Now, this is an example of a left alar ligament rupture, and this patient had also had left neck tongue syndrome, which is a sign of excessive rotation at 1-2, instability of 1-2 during right rotation. So assessing the stability of the craniovertebral complex is simple, it's effective and safe. It does not require symptom production.